Hi, I'm David, a citizen of Delhi, India. What is India, you may ask? It's a combination of rural and urban areas, though a majority of the population leans towards the rural category. It's located in South Asia and is the seventh largest country in the world. We are very overpopulated. 1.4 billion people live here. This is a day in my life. Like every country, there are many hazards here, four to be specific: chemical, cultural, biological, and physical. Some that I encounter every day are carbon monoxide dangers in my workplace, malaria outbreaks, and flooding. All of these have a high risk factor. As soon as I walk out of my house, I inhale carbon monoxide, not voluntarily. I breathe it in and it burns. Carbon monoxide is odorless, tasteless, and colorless. It's a very poisonous gas that can be harmful when inhaled in large amounts, potentially causing poisoning and death. In fact, carbon dioxide is related to about 80% of deaths in my country. In India, it's mostly because of emission from factories when fuel is burned. For example, enormous CO amounts are emitted in northern India due to the burning of wheat and paddy stubble by farmers. Air quality is a big concern in India, especially in cities like Delhi, where I live. Air pollutants like particulate matter, sulfur dioxide, carbon monoxide, and ozone are repeatedly exceeding the national ambient standards and the World Health Organization guidelines in this country. Symptoms of carbon monoxide poisoning can vary depending on the level and duration of exposure. Common symptoms include headaches, dizziness, weakness, nausea, vomiting, chest pain, and confusion. High levels of carbon monoxide exposure can lead to severe health effects like loss of consciousness, coma, and even death. Chronic exposure to low levels of carbon monoxide can have long-term health effects, including neurological damage. The ease of transport and the severity of its symptoms make CO have a high risk factor. There are things we can do to reduce exposure, however, including protection through wearing a mask to prevent inhalation of carbon monoxide, also through promotion through public awareness. One of the most important steps in prevention of indoor air pollution is education via spreading information among people about the issue and the serious threat it poses to their health and well-being. A current event related to this situation is a recent toxic gas leak occurring in a dyeing and imprinting mill. The workers inhaled the gas caused by an illegal dump of waste chemicals and started to suffocate, killing 6. Many age groups have been hospitalized, with some being in critical condition. This leak was not an accident, due to the fact that hazardous chemicals were in the way of being discharged. It has not been yet remedied, but investigations are still ongoing. I get to the factory where I'm employed at around 9 a.m. like I always do. India has a workforce of 524 million people, 85% of which are in the unorganized sector. An unorganized sector is when there are no formal work contracts, social security, or health benefits that organizations typically provide to employees. When I arrive, I get straight to work. I would put on my safety gear, but my job doesn't offer us any. In fact, it's very dangerous here. In 2021 alone, studies found that an average of 7 accidents were reported every month in Indian manufacturing industries, killing more than 162 workers. Aside from that, our work culture has a toxic tendency to glorify long and hard hours, leading to widespread burnout and exhaustion. These unsafe working conditions often lead to physical injuries, chemical exposures, stress and mental health issues, and other problems. Because proper gear and training aren't normalized or required, these conditions become a cultural hazard. Cultural hazards, also known as social hazards, are threats as a result of your location. The machinery and equipment vary from having sharp blades, unbearable heat, and other harmful features. This can cause accidents like falling, cuts, burns, or crushing injuries. Chemicals are also a common substance us workers can come into contact with, and without proper protection, we can get easily burned, develop respiratory problems, and other acute health issues. Because of how frequently Indian citizens have come in contact with these situations and the severity of its consequences, poor working conditions have a high risk level. The mode of exposure is through direct contact with hazardous situations and or the chemicals in the air. But I have come up with some ideas to reduce exposure for myself, coworkers, and everyone else. For protection, providing PPE, which stands for personal protective equipment like hard hats, gloves, etc., can protect workers and can minimize exposure to hazards that could cause injuries and or illnesses. For promotion, adding symbols and posters around the location can assist employees and act as a reminder. dangerous equipment should have usage warnings and instructions nearby. For example, this raises awareness and ensures everything is being operated in an appropriate manner, minimizing potential damage. For prevention, implementing safety codes and proper training can prepare and prevent hazards from affecting the workers in the first place. This would address the issue at its root. A current event surrounds how child laborers are exposed to hazardous chemicals in Indian firework industries. A recent investigation revealed the widespread use of child labor in India's fireworks industry, where children as young as 8 work in dangerous and unhealthy conditions. These young workers are exposed to a cocktail of hazardous chemicals, including lead, arsenic, and magnesium, through mixing gunpowder, hand-dipping fireworks, and operating dangerous machinery. This can cause lead poisoning, respiratory problems, psychological trauma, and more. Remedies include increased enforcement of child labor laws, increased penalties for offenders of those labor laws, and consumer awareness. While the recent awareness is a positive step, the problem of child labor in the fireworks industry remains deeply established. Many children are lured into these jobs by poverty and lack of education, and the cycle continues due to inadequate enforcement and tax regulations. I have a lot of friends at work, so it doesn't get too boring, but lately a lot of them have been missing to biological hazards. It's mostly because of the high-risk disease, malaria, which can sometimes be deadly. Malaria's mode of exposure is through direct contact, since the only way to get infected is to be bitten. It's caused by a parasite that infects a certain type of mosquito, and that mosquito type then feeds on humans, which spreads disease. People who get malaria are typically very sick with high fevers, shaking chills, and flu-like illness. Malaria is one of the major public health problems in India, killing 1 million people per year. That's more than all wars ever fought. India carries 1.7% of the global malaria case burden and 1.2% of global malaria deaths. Symptoms typically include fever, chills, sweats, headaches, muscle aches, and fatigue. In severe cases, malaria can lead to complications such as respiratory distress, organ failure, and altered consciousness. Cerebral malaria is a life-threatening complication that can cause seizures, coma, and if not promptly treated, can result in death. Malaria can also lead to destruction of red blood cells, causing anemia. This is especially common in individuals with frequent or severe infections, in which infection can lead to complications such as low birth weight, preterm birth, and maternal anemia. Here's some suggestions that I have on preventing exposure. Protection. Vector control tactics like insecticide-treated nets and indoor residual spraying of insecticides. Promotion. Public service announcements, engaging and informative PSAs for TV, radio, and social media platforms will capture attention and educate people about malaria symptoms, transmission, and prevention methods. Prevention. Avoid going to areas where transmission rates are high. These can include cities like Bombay, Mumbai, and New Delhi, the capital. There are also some chemoprophylaxis for malaria that are recommended by the CDC. These include atovaquone proguanil, doxycycline, and mefloquine tafenoquine. A current event is the malaria outbreak in Odisha, India, October 2023. Heavy monsoon rains carry ideal breeding grounds for mosquitoes carrying the malaria parasite. Poor sanitation and inadequate access to clean water made the situation even worse. The outbreak has placed immense strain on the healthcare system with overwhelmed hospitals and shortages of essential medicines and diagnostic kits. Children and pregnant women are particularly vulnerable with reports of severe anemia, organ failure, and even death in some cases. Indian authorities have launched a multi-pronged response including rapid response teams, which is the deployment of teams to affected areas for case detection, treatment, and mosquito control, and mass drug administration, distributing anti-malarial medication to entire communities to prevent further spread. While the outbreak appears to be slowing down, the situation remains fast. After work, I decide how to get home. Since it's flooding season, I have to pay attention to which roads and places are affected so I don't get caught in the natural disaster.
Please help me. Here too much raining.
Floods are the most common natural disaster in India, posing a very high risk. Out of our country's total geographical area of 329 million hectares, there are more than 40 million hectares which are flood prone. Their mode of exposure is through physical contact with people, the environment, or anything else. They are caused by monsoons and cyclones that encourage more rain to come. Climate change has also contributed to increasing the likelihood of landslides and flash floods, especially in vulnerable mountain areas. Additionally, our infrastructure isn't prepared. thus not having proper drainage, causing the actual flood itself. They can cause waterborne diseases. Floodwaters can become contaminated with various pollutants, including sewage, chemicals, and other contaminants. This contamination, ingestion, or any other form of contact can lead to the spread of waterborne diseases. Respiratory issues like mold growth is a common problem in buildings and homes that have been flooded. Mold spores can cause respiratory problems, allergies, and enhance existing respiratory conditions such as asthma. Contaminated food supply, displacement, and crowded conditions are also one of the major problems that come with flash flooding. People forced to evacuate their homes may end up in temporary shelters or crowd. Some solutions I have for flooding include the following. Protection. To reduce urban flooding during heavy rainfall, it is important to quickly move water away from built-up areas. We can also add chlorine to clean waters to reduce the chances of waterborne diseases when floods. For promotions, we can implement drainage systems that don't clog up as easy when these floods do occur. And for prevention, to prevent riverbank erosion, Mahajan of Makkaferries, India, suggested combining geomats with hydroseeding. Makkaferries' Makma Prada, which is also from plastic, is placed over newly sown plants. Additionally, flood management by establishing dams. Various large and small dams like Damodar Valley Corporation, Bakra Dam across Sutlej, the Hirakud Dam on the Mahanadi, etc., are constructed to control flood. A current event is the recent deadly flash flood that swept through the northeast of India, killing 40 people, destroying infrastructure, and displacing over 100 people. Over 22,000 people have been affected and are being placed in relief camps. About 2,000 of people have been rescued, however, the search is ongoing. And that is a day in my life in